Hello everyone, now let us discuss about CPC mock question from case studies. Coming to the question, operative report indicates orthoscopy. Location, it is hospital outpatient. Preoperative diagnosis is left medial meniscus tear and discoid lateral meniscus and plica. The post-operative diagnosis are same and the procedure performed is left knee orthoscopy with partial medial meniscectomy and lateral meniscectomy. Anesthesia is general, estimated blood loss is minimal, drains none. Coming to the history, the patient is a 45-year-old female that presents with a history of left knee pain. MRI demonstrate the above problems. Coming to the procedure, she was taken to surgery after appropriate anesthesia was achieved. The left knee was prepped and draped in an orthopedic manner. I made two portals in the left knee, one medial and other lateral to the patella tendon. Sharp dissection was carried through the skin and blunt dissection was carried into the joint space. On examination of the knee, I appreciated, here I indicates physician, I appreciated the patient had a grade 3 chondromalacia involving patella. This is one more diagnosis, chondromalacia of patella. There is a little bit of rubbing on the medial foramen condyle. This was sort of diffuse on the patella but just a localized area on the medial foramen condyle. There was redundant fat pad and plica rubbing against the condyle. We went ahead and debrided the plica. Plica debridement is also performed. The medial and lateral gutters and the suprapatellar pouch was noted to be clear. The medial meniscus was noted to have a tear. The medial meniscus was noted to have a tear on the posterior horn and this was debrided back. This was an avascular area. The anterior cruciate ligament was noted to be intact. No loose fragments were appreciated in the posterior fossa. We went ahead to the lateral side and we had a congenital discoid meniscus. This is also a diagnosis, congenital discoid meniscus. We went ahead and debrided this back to stable looking lateral disc material, trimming it up to more normal configuration. We checked and palated the cartilage. The femoral condylar cartilage appeared to be in excellent condition and the tibial cartilage appeared to be in excellent condition. However, when probing in, it appeared to be soft, giving a sort of grade 1 chondromalacia type appearance. This is sort of diffuse and on the posterior margins primarily. The patient appeared to have tolerated the procedure well and the left operating room in a good condition. Pathology report later indicated grade 3 chondromalacia of patella. Now here meniscectomy is performed. And if you go for meniscectomy under knee joint, you can find orthoscopic. Here the procedure performed was orthoscopic. Orthoscopic meniscectomy was performed. So the CPT we must refer are 29880 and 29881. And if we go for the CPT description 29880, here it is not a complete code because it is starting with a small letter. The complete description of 29880 is orthoscopy knee surgical with meniscectomy, medial and lateral. Here remember medial and lateral including any meniscal shavings, including debridement and shaving of articular cartilage, that is chondroplasty, same or separate compartment when performed. In our case, both medial and lateral meniscectomy was performed. So the correct code is 29880. If we see the description of 29881, it indicates with meniscectomy lateral or medial. But we want lateral and medial. So the correct code is 29880. Here we need to go for derangement. Under derangement you can find knee. Under knee you can find meniscus. Under meniscus you can find lateral medial. Our question is tear of posterior horn of medial meniscus. So under medial, if you can go for posterior horn, the code is M23.02. This is the correct code, M23.02, but this is further expandable. The tick mark here indicates it is further expandable for laterality. So you need to go and check the tabular list. The next ICD is discord. You have a meniscus discord. So you need to go for discord. Under discord you can find meniscus congenital. The correct code is Q68.6. This is the complete code. So the correct code for derangement of posterior horn of medial meniscus due to old tear or injury is M23.222. M23.222 is the correct complete code. It indicates derangement of posterior horn of medial meniscus due to old tear or injury left knee. This is the one of the correct code, M23.222. One more ICD is chondromalacia. Here you can find chondromalacia of patella. So under chondromalacia you need to go for knee. Under knee you can find patella. The code is M22.4. Here also tick mark is there. So this code is also further expandable for its laterality. The next is plica. You can find plica under plica syndrome knee. The code is M67.5. Here it is not visible, but this code is also further expandable. Here you have a tick mark. Syndrome knee M67.5. This is further expandable. Now let us see the complete code for chondromalacia and plica. For chondromalacia patella, the correct code is M22.42. Chondromalacia patella left knee. Here orthoscopy of left knee is performed. So laterality is left side. M22.42 is one more correct code. Chondromalacia patella left knee. Next is plica syndrome. The definition is plica syndrome is an irritation or inflammation of extension of the synovium plica. So this is also for left knee. So the correct code is M67.52 plica syndrome left knee. And here you can see what are the correct CPT and ICD codes for the following scenario. The correct option is option C. The CPT is 29880 along with LT modifier to indicate left knee. The first ICD is M23.222. The next is Q68.6 for discord meniscus congenital. The next is M22.42 and finally M67.52 for plica of left knee. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.